My name is Paolo Guido CAMICI. I'm Professor of Cardiology at Vita Salute University at San Raffaele Hospital in Milan. This morning I have a lecture in the session on updates of ischemic heart disease, and my presentation will deal with the clinical manifestation of coronary microvascular dysfunction. This is a condition that we have recognized and demonstrated over the past 15-20 years, and is the cause of ischemia and angina in patients with angiographically normal coronary arteries. These can affect quite a large number of individuals. Most of them will have risk factors such as arterial hypertension, hypercholesterolemia, diabetes, and the part of the coronary circulation that is affected by the disease is the more distal part. These are vessels below 0.5, 0.3 millimeters diameter, in other words 300 to 500 microns, that are not visible at angiography. That's why people have typical chest pain, ECG manifestation of ischemia. They undergo repeated angiograms that do not show any atherosclerotic disease. The only way to demonstrate this microvascular disease is to do tests such as measurement of coronary flow reserve that probe the function of the microcirculation. You can also run functional tests such as acetylcholine that will, in some cases, demonstrate microvascular spasm. The angina is very similar to the angina that is seen in patients with atherosclerotic disease. Pain can occur during effort only, both during effort and at rest, or at rest only. The treatment is there is no specific treatment, but some of the drugs that we use to treat conventional ischemic heart disease may work to reduce the number of episodes. However, there is a need to develop new drugs, and some of them are already in use in other countries such as Japan, the Rho kinase inhibitors such as Fasudil, as well as to use drugs such as ranolazine that might act on this condition, for instance by reducing the impairment of diastolic perfusion, and there are several trials underway to test whether or not this drug is active. So in summary, this is a condition which is frequent, which is frequently unrecognized, and that may impair the quality of life and needs really attention from physicians.